Now we'll discuss about hyperparathyroidism. So hyperparathyroidism, hyper means more, parathyroidism, parathyroid hormone is secreted more. So firstly we'll talk about primary hyperparathyroidism. In primary hyperparathyroidism, the primary cause is that the parathyroid gland is producing more parathyroid hormone. Okay, we'll discuss about secondary and tertiary, then you will be knowing what is the difference. But in primary, what is happening, that the parathyroid gland is producing more. Why the parathyroid gland is producing more? The most common cause is there any tumor? Okay, if there is any tumor of the parathyroid gland, okay, the gland is more, so it will obviously produce in more quantity. Okay, so what will happen? If there is excess of parathyroid hormone, what it will do? Parathyroid hormones function is to increase the calcium level in the blood. If it is activated when the calcium levels in the blood is low. Okay, so what will parathyroid hormone do? It will increase the calcium. By how? It will reabsorb more calcium from kidney, from GIT through vitamin D, and from this bone. Okay, if you don't know, then please watch the previous video. Okay, so if PTH is more, that is there is more calcium reabsorption. Okay, if there is more calcium reabsorption, firstly we'll talk about bone, because there is a major effect on bone. On bone we talk about that calcium is reabsorbed, phosphate is reabsorbed. If parathyroid hormone is more, then calcium is reabsorbed more from the bone, that is bone is becoming weaker. Okay, that is osteoclast activity is more in bone. So what happen in bone, there will be formed cyst. Cyst is any hollow area where osteoclast is filled, so that kind of cyst will be formed. So this cystic type of bone disease of hyperparathyroidism, this is known as osteitis fibrosa cystica. Osteitis fibrosa cystica. Okay, this is what happens with the bone. It becomes weaker. So when this kind of activity is going on in the bone, then obviously the osteoblast will be stimulated, that the bone is going in vain. So the osteoblast activity also increases. Okay, but the osteoclastic activity is so much that the osteoblastic activity cannot do anything. But osteoblastic activity will produce alkaline phosphatase. You know, when the bone is forming, it is if there is alkaline phosphatase present in the urine, you can say that the bone is forming. But here even the bone is being destroyed, but the alkaline phosphatase will be present in urine. Why? Because osteoblastic activity will be more. Even if it is more, the bone will not be made, it will be destroyed, because the osteoclastic activity is more due to the parathyroid hormone. It is an attempt of the bone that it increases the osteoblastic activity so that the bone can be normal, but it doesn't happen. So but in this case also alkaline phosphatase is present in the urine. So now if we talk about CNS, what happens when there is hypercalcemia? This condition is when calcium is more reabsorbed and more calcium in the blood, that is known as hyper means more, cal means calcium, emia is in blood. Okay, more calcium in blood, hypercalcemia. So what happens to the CNS when there is more calcium? There will be depression. Okay, there will be depression kind of states when there is hypercalcemia. How? If I'll talk, these are the sodium channels. You know how this depolarization occurs when there is entry of sodium inside, the positive increases. Okay, and then the depolarization happens, and then after depolarization the nerve impulse is there, like activity. So this happens when during a impulse transduction. But this sodium channel is guarded by calcium. Okay, if there is hypercalcemia, if there is more calcium, then the sodium entry is reduced. So then this sodium won't be able to enter the through sodium channels into the cell. So there will be no depolarization. So there will be depression, because the nerve synapses are not, means the impulses are not being carried. So depression will be there. Similarly, when there is hypocalcemia, like calcium is low level, then this is less guarded, then more sodium will be, then depolarization more, and then that will lead to tetany. Okay. Thirdly, what happens if we talk about there is lot of PTH hormone, okay, which is secreted. Now what happens even if the extracellular phosphate concentration rises instead of falling? Why? Parathyroid hormone's main action is to increase the calcium level, okay, but we are saying that its phosphate is also increasing. How it is increasing? Because from the bone we are removing both calcium and phosphate, but parathyroid hormone is removing the phosphate through kidney. As we have discussed, it removes phosphate through kidney through by blocking the phosphate transporters and blocking the phosphate reabsorption from the kidney. So when this but it is happening, okay, I believe, but there is so much of the phosphate which is removed from this bone that probably the kidney cannot excrete all the phosphate being absorbed from the bone rapidly. So the calcium and phosphate in the body fluid becomes greatly supersaturated, and when this happens it will lead to the calcium phosphate formation. Okay, this calcium phosphate will be formed. Now these crystals are formed, and these crystals are deposited in the lungs, in the stomach mucosa, okay, in thyroid gland, means various parts of the body it is deposited. Now this is known as metastatic deposition of calcium phosphate. This will happen, metastatic deposition of calcium phosphate. Now here in urine, not only phosphate levels are there in the urine, okay, it is increased in the urine. Calcium level is also there because calcium is so much reabsorbed, it cannot be taken it cannot be reabsorbed by the kidney a lot, okay. So the urine in kidney, the phosphate level and calcium level also increases. So as it is moving in the kidney, the calcium phosphates stones will be formed in the kidney. It will get precipitated and kidney stones will appear. So this was about primary hyperparathyroidism. Now comes the secondary. Now in secondary, there is no problem in parathyroid gland. Okay, here there was a parathyroid gland tumor, so the parathyroid hormone was produced more. But in secondary, there is not a problem in parathyroid gland. There is the problem is there is a chronic low level of calcium. When there is chronically low level of calcium, it will stimulate the parathyroid hormone to be released more. If the parathyroid hormone will be released more by the chief cells, that is hyperparathyroidism. So this is secondary to the low level of chronic calcium. Okay, so this is secondary. Now the question is, why chronically low level of calcium is there? There will maybe several reasons. The most important reason which we discuss is chronic renal failure. Now what kidney does? Kidney's main function, it will remove the phosphate. Okay, it will excrete out the phosphate in the presence of parathyroid hormone. But if there is renal failure, then the phosphate will be more in blood. So that will cause hyperphosphatemia. Okay, whatever. So when there will be hyperphosphatemia, then the calcium which will be present, okay, even if it is low, that means the calcium which is present, it will bind with the phosphate. Okay, and it will get complexed. So now what will happen? It will result into reduced calcium, free calcium. Calcium is there. Okay, there was normal calcium which get in the renal failure. What happened? The phosphate is not removed in the urine. So the calcium will bind with the phosphate and form complex with him. So now what will happen? The free calcium ion will reduce. Now less calcium ion will stimulate the parathyroid hormone to be increased. So there will be more PTH. Other cause, that is if you are taking low diet of calcium. Okay. Third, can be when you are taking diet which is low in vitamin D. Because vitamin D reabsorbs calcium from the GIT, as we have discussed. So if it is less, when this is absorbed less, when there is condition steatorrhea, that is fatty stools. What happens in fatty stools? This condition where the fat is malabsorbed, it is not absorbed properly, fats. So as we know that vitamin D is a fat soluble vitamin, so it is also not absorbed, it is also in feces. So this vitamin D becomes deficient, and due to this the calcium is reabsorbed less. So that may be the cause of chronic less calcium levels. So whatever the reason is, we have discussed that the parathyroid hormone is more. Now when this will be more, we know that it will stimulate the osteoclast eventually, and we will have weaker bones. All this problem is due to chronic renal failure, then this is known as renal osteodystrophy. Because of renal, this is osteodystrophy. Third one is tertiary hyperparathyroidism. Tertiary, what happens in tertiary? There is chronically low level of calcium. Any cause, which we have discussed, means there was secondary hyperparathyroidism first. Then what happens? This low calcium level will stimulate the parathyroid gland to release parathyroid hormone. So what will happen? This low level of calcium will stimulate parathyroid gland and it will irritate it. Okay, it will stimulate, it will get irritated. Then what will happen if someone gets irritated? It will ये अपना मुंह फुला लेगा. That is adenoma or something, tumor or like such kind of neoplastic cells will appear. If there is neoplastic, then this PTH level, which was more in secondary, it becomes very much. So parathyroid hormone becomes very large. This is hyperparathyroidism. There will be too much of the bone destruction. What we discussed in primary, there was parathyroid gland problem, there was any tumor. Firstly, there was tumor and parathyroid hormone increases, and all this which I have discussed on bone, on calcium, on this nervous system, what is happening, metastatic. Then in secondary what happened? Chronically low level of calcium, which was due to mal reabsorption basically of calcium, or less intake of calcium or vitamin D. So if this is there, then PTH increases. This is secondary cause. And when tertiary, when there is chronically low level of calcium, but it stimulates the parathyroid gland so much that it irritates and get edematous or it neoplastic, that it produces too much of parathyroid hormone and there will be bone destruction. So this was all about hyperparathyroidism. Thank you.